We've got a really awesome set of speakers who are going to share with us today. I've asked them to kind of do the impossible and keep their comments to just 3 or 4 minutes. I'm sure any one of them could take up this whole time to talk about how they've made adaptations to respond to the coronavirus. And since we have such a great set of 10 people, we're gonna have to keep these pretty short and sweet. So we're going to get started. I will be introducing them as we go, and they know the order that they're in. So hopefully they'll all be ready to go if we have everybody on the line today. And that'll be my way for nudging on time a little bit. So I'll be doing my best to keep track. Okay, so our first update comes from Caroline Mishniak of Eastern Market, who is also a MFIN Advisory Committee member. And last we heard from her, she was still on the road as usual. Caroline, are you there? Caroline, we can't hear you if you are there.
Looks like she's still on the line, but she's I can try to get her to unmute.
And I can always come back to her.
Hi, everyone. Can you hear me now?
Yes. Hi, Caroline.
Hi. Sorry about that. I'm like dialing in because my service is not amazing. But I'm happy to give an update from the field from Eastern Market. I don't know if Colleen gave an introduction, but I'm the Grow Eastern Market program manager there. And we are a food hub kind of program that works with small farmers and mostly restaurants. And obviously, since the spring, there has not been a ton of business to be had with restaurants. So this past March, we really pivoted in the direction of food boxes. And I'm sure lots of people on the line know about what a food box looks like. But our food box found itself being as a curbside alternative to our market, and also a way to get produce, basically like a multi-farm CSA share box in the hands of our Eastern Market shoppers. So we started off the season during like the height of the pandemic this spring, doing about 300 boxes a week. We've kind of transitioned throughout the spring and into summer. We were awarded a USDA grant. That's the Farm to Families grant that some of you guys are probably familiar with. And so we actually upped, like in a separate lane, we're doing 2,000 boxes a week of mostly Michigan, but not only Michigan produce. And those were being donated through various nonprofits in the city of Detroit. And the big kind of like piece for that programming is that we went through a GAP audit. And then also we were able to get some Michigan farmers that we work with GAP certified themselves. So definitely a big learning experience, a lot of time and effort this summer spent on that. We were also lucky to work with Center for Regional Food Systems and Henry Ford Hospital Dearborn to get some support to do food boxes for healthcare workers this last spring. And we're kind of we transitioned out of the way that was working. We also were working with Farm to Freezer, Brandon, who's on the line with that. And then we are planning kind of a new iteration or a second phase of that going into the winter. So food boxes, food boxes, food boxes. We still have been working with some grocery stores and some other, restaurants and people who are doing carry out, but it really has changed the way that we're doing business this season.
Thank you so much, Caroline, and thanks for keeping that short and sweet. We hope to have some time for questions at the end of all of the speakers, so stay tuned. Next up is our friend Sarah Monty calling in from the UP. She's with the UP Food Exchange and Marquette Food Co-op and also a member of the MFIN Advisory Committee.
Hi. So one thing I'd like to explain to the whole group is that some of the things that I present are actually the result of the whole UP Food Exchange, which the UP is a lot bigger than sometimes people realize, and there's a lot of different people who work on our committee. So while we work very hard on farm to institution, there's also a lot of activities we do around developing food systems as a whole, including direct to consumer work and things like that. So when COVID hit, we were really able to shift our direction and say, well, how can we help get this food into as many people's hands as we can? And if that's not through an institution that we're shut down and not purchasing, what are the other avenues that we can do this? And there were some really great projects that happened, both in terms of marketing and communication with consumers to let them know how to source food. We had members of the team, I think Alex is on this call from Taste the Local Difference, and they really moved fast to help connect people with websites so that farms could start selling directly to consumers in a more contactless way. And then we had groups that worked together both in the Western UP and over here more in the Central in Alger, who really thought about how do we get this food into the hands of the people who need it most while also creating sales for the farms. And so two different independent programs were started through our network that were basically collective CSAs that, either were fully funded through a health foundation or had a sliding scale to let people pay what they could afford, but still have access to the best quality food around. So we're still working on getting the metrics from the folks who worked on that program to be able to share out how that worked and best practices, really. But we're really excited about how people pivoted quickly to allow that access. I think in some ways, we definitely got the food out there. It's not a new story for the UP. Like everywhere else, COVID-19 exposes all the weak parts of the food system that already existed and exacerbates them. But our supply lines that were already not great are especially bad right now. So one thing that we're really trying to think about for the future and continue working towards is how do we grow the farm situation here. Right now, farmers are experiencing a great demand from consumers to the point where some of us, like some of the grocery stores that we work with, are having difficulty sourcing what they would like because it's being sold elsewhere. We also are seeing a huge bottleneck with meat processing. So for example, with beef, some of the suppliers are saying there's not going to be beef available until January. So stores are having to shift to other products that are not local to fill that hole. So we knew that processing was a problem here in the UP, and it's definitely become more apparent. So the good news is that it has really got everybody talking about this and the need to move more quickly on that kind of project. So I would say, one of the things that I was really excited about is how the networks that we have already developed really allowed us to move quickly on projects together and to really hear quickly from people across the UP what they needed and to get those sales going, but also expose those supply line issues that we need to keep working on.
Thank you, Sarah.
Thank you, Sarah.
Sorry for that feedback. Okay, John Fay from Gordon Food Service and a MFIN Advisory Committee member is up next. I know he was on phone. John, are you there?
Yes, I am. So good afternoon, everyone. So my apologies, having some technical issues, can't join the Zoom meeting, but I just prepared a few things that Kelly, you'd asked me to on the different things. So the kind of the adaptations we've made, kind of similar to what Caroline and Sarah both said, going into and focusing in a lot on the food box program. We've had a lot of success in that area, coordinating with multiple suppliers and growers within our distribution network. And the numbers I'll share are beyond just the state of Michigan. So this is across our entire distribution network, but and beyond just fresh produce. But we've in the first 2 periods, we distributed approximately 1.6 million boxes of food throughout the various food banks and food hubs that we were able to partner with throughout this process. Of those 1.6 million, approximately 270,000 of them were fresh produce. And for those who are just joining, I manage the produce department for Gordon Food Service in kind of the Midwest. And so of those 270,000 boxes that we brought into our warehouses and distributed, we only had 1 box that was liquidated out of all of those cases, which from a logistics standpoint, in terms of coordinating all of the orders, because everything was pre-booked, that was quite an accomplishment to make sure that everything got shipped out and distributed accordingly. And that could have, I don't know for sure, but that could have been even a damaged box that we may have damaged internally. I don't know for sure, but so we did have quite a bit of success in that arena to get the foods to the different organizations to actually distribute it to families. So proud to be a part of that endeavor to help through the pandemic. A couple of the adaptations that we've kind of been working through as a company is reevaluating our product mix that we offer to customers and trying to pivot to better meet their needs. So whether it is just overall, do we have the right product mix for their needs? Do we have the right pack sizes? So a lot of customers are asking for smaller boxes. So rather than a 25-pound box of tomatoes, we're offering a 5-pound and a 10-pound case to many customers, which have that's seen a lot of success and growth in those areas, and looking at other commodities in that same light. From a need standpoint, we're still struggling with our incoming vendors filling existing POs and really getting on-time delivery. I forget if it was Sarah or Caroline that mentioned just kind of the transportation side of it is still a challenge. Trucking is very tight right now. I've heard anywhere from for every full truckload of product that we have that we need to come into our facility, I've heard anywhere from 1 to 15 drivers are missing. So not missing, but for every 1 truck that we have, they can pick up 5 or 10 other loads or more from that same driver. So there's a real shortage on truck drivers, and that's been a shortage for quite some time. And we're really starting to feel the effects of that. And because of that, that's driving freight rates up and driving costs to the end user up as well. So not great for the end user, but it's just kind of a reality of where we find ourselves at the moment. And then one thing that from a membership perspective to understand as a distribution company, looking at our customer base to have flexibility, understanding that supply chain is having challenges. And so just because you always ordered a particular product doesn't mean that that is always available. I know, for example, on the school side, schools would oftentimes order multiple flavors of raisins, for example, a strawberry or a sour patch like strawberry or watermelon flavored raisins, and they just don't have the capacity to keep up with all of the demand. So the various manufacturers are limiting their SKUs of production. And then another example of that would be like for canned goods. We've had many requests for retail sized canned goods for customers to be able to create food boxes of their own to sell to their customers that are coming into the restaurants here or there. And the canners just don't have the capacity or they don't have the inventory to move through the food service distribution channel. So those are kind of some of the updates that that I have, and I'll be happy to answer any questions later on, as Colleen said.
Thank you so much, John. Appreciate that from the broadline perspective. And up next, Larry Weber from the Food Bank Council of Michigan. Thanks, Larry.
Hey, thanks for allowing me to be here. Well, I think I'll probably be piggybacking on a few people, Carolyn, and then also John on the boxes. The 7 food banks have been recipients of these boxes for the distribution to their pantries and their mobile distributions. But I gotta say, over the last 6 months, we've had to do some a lot of rethinking on how we do our own distributions. The food banks receive a lot of the product, and then they go on to redistribute it to the food pantries. But obviously the food pantry is run by volunteer workers, of people that a lot of seniors are their labor force. So a lot of the food pantries, even though desperately needed, have had to close because of lack of staffing and what have you. So the food banks have moved to do more of a mobile and just arranging and minimize the amount of touch. So delivering to to church parking lots and doing their distribution through there. We've had some challenges with supply, the same as what John was talking about. The manufacturers over in the west side for canners. We've had some of the plants with COVID where they have a positive case and the plants are shut down. So the labor to the plants, steel and availability for even the packaging has been an issue. We've been lucky I think because of who we are, that we've been able to get the National Guard to support us and do some of the distributing. And when we're desperately needing the repacking, we've had to call upon them, and they've been great. We've also had to look at a lot of the food service companies, distributors, John's included, where it's at one time knowing that we were able to repack, that if we took a food service quantity size product, we could make it into smaller, more retail or family size products. But unfortunately, with the lack of volunteers and the lack of no touch, that became an issue. We've even had, we've had to scramble where I've had a distributor that had, 50-pound boxes of potatoes, and my potato farmers up in the north have capacity for repack because it was at the end of their season, finding a truck to truck it up to Northwest Michigan, have them open up the 50-pound boxes and then repack it into a 5 to 10-pound bags for families to take home. So we've had some interesting ideas, and luckily we've had some financial backing that's helped us. And then along with those boxes, we're on there, I think, the 3rd round now for to the food banks. But we're also looking at eventually coming up. USDA, TFAP will probably be doing some reducing, I guess this is the best way, a lot of the trade mitigation product and some of the bonus purchases at the USDA. It's an unknown right now, but we've also, with our distributing, we've partnered up with some groups that we really haven't had a chance with before. We've done some with the area agency on aging, where we've partnered up with where the food banks have actually done some of the boxes, and then we've had those boxes delivered to their central offices, and then they coordinated with some volunteers for seniors that are homebound that weren't part of the traditional Meals on Wheels, but didn't have the capability to get to the stores for food purchasing. So we've been able to do a couple of deliveries like that, sending them 27 to a 28-pound box directly to their home. But yeah, I think it's been a crazy, like I said, like John was saying, on supply. We call up our our past vendors, and they'd like to help, but unfortunately, labor, supply, everything was just affected to, just had to be a little bit more creative to get things done. But we've been able to do it. I think that's it. I'm here for questions too on people that work with us.
Thank you, Larry. And next up is Glenn Knopfsinger, who is a food service consultant and a MFIN advisory committee member. Glenn, thank you.
Yes, hello. So I'm going to give a little bit of an update from the child care centers in the Battle Creek Community Foundation here in my local Battle Creek area and the challenges that they've faced. Wide variety of challenges. I think most people have touched on. The challenges we had before are still there. They're just exacerbated to an extent that they're barely manageable. So if we go back into the spring, the centers themselves went through periods of close down and then staged reopening. And now we're back up to speed. There is a need for childcare. But if you go back into the summer, spring and into summer, that close down resulted in a loss of some staff. And then to come back up to full speed in the fall heading into school, the food service programs at these centers are about 50% staffed right now. So they're back up to the volume that they used to do, but they're faced with increased costs across the board. And in some cases, the revenue has taken a little bit of a lag to catch back up, and you have half the people doing the work. So that's challenging in and of itself. The programs were challenged before for the food service in general, but that business challenge, closings, reopenings, and then trying to get food in, they really are, they're strapped in being able to do any extra programming, such as local foods, to make the extra phone calls, to be able to find something that's it's been canceled or it's out of stock or it needs to be reordered. They really default back to, I've got to get this done. And the default tends to be a prime distributor or something that they're familiar with. So I've done some work with them to identify where we can streamline operations and understanding meal components. And this, I don't know if you'll be able to see this, but I'll talk through this real quick. So we basically take a straightforward approach. The reimbursement rates for CACFP from the MDE program through the CACFP centers results in, if we run a high food cost of 40%, gives us about 76 cents to provide a breakfast, $1.40 to provide a lunch, and 38 cents to provide the snack. Now, if we break that down into components, what that means for local food is a half cup portion of fruit or vegetable has a high and upper limit rate of 28 cents for that portion. So I think there's some real challenges there. First, multiple small centers trying to buy wholesale case volume pricing and then distribute amongst themselves, and the extra staff, training, kitchen facilities that it takes to work with local food to process that in-house. Peeling, trimming, washing, portioning is a real challenge for these centers right now. They need ready-to-use products that they can quickly portion and get out to kids. And in the market, simple things like local blueberries, they're in the $7 a pound range if you're buying prepackaged goods. And we just don't have that. At tops, if we've done everything else and we're running efficiently, we can spend maybe $2.25 per pound on all products. That's an upper limit for meat, for proteins, vegetables, fruits. So going forward, I think there's real challenges to think about at this level, where we definitely want local foods fed to our developing children, our young children, and to have them learning about this in the classroom and understanding where real food comes from. That was challenging before, but now with the challenges that COVID has put on, I think we kind of need to take a step back and do a reset and think about how we can help There may be some need for local financial support from groups like Battle Creek Community Foundation and others to make up that gap in the cost of local foods and to be able to tell that story and to bring that programming to them in a way that they can use it. Yeah, so that's my update on the child care centers here in this area that I'm working with.
Thank you, Glenn. That's really insightful. Got my timer going here. Also, now we're going to hear from Xavier Jaramillo, who is with Spectrum Juvenile Services and a MFIN Advisory Committee member also.
All right, we've had our own little challenges. We ended up switching out to a 3-week rotating menu instead of 6 due to limited staffing and just supply chain issues. There is limited amount of things we can receive. We also were part of the Farm to Families.
Xavier, it sounds like you have some background noise.
Okay, let me try to take the earpiece out and try to see if that helps a little. Take the earpiece off with that.
That sounds better. Thank you.
Excuse me. Is that better?
Yes, much. Thank you very much. Sorry to
Okay,
interrupt
took the earpiece off. So we're also recipients of the Farm to Families program, where we ended up distributing about 3,000 boxes of dairy and vegetables and protein and chicken boxes to the Highland Park community. Most of the time I did that with a couple of my employees. We passed it out, and that's about it. We've have no staff for the most part. Myself, my supervisor, and 2 other full-time employees. Out of traditionally we had 12 full-time employees here in our facility. So 6 days out of the week, myself and my supervisor, we actually cook most of the meals while trying to complete all the needed state paperwork that's required by us. And we're still being required by state licensing to do different assignments that's separate from the MDE program, MDE food system that we receive. So currently we actually have to go through a full environmental inspection. Even though Wayne County is not doing inspections, we still have to go find a way for Wayne County. We told it Wayne County will pay extra for them to come in and do an inspection because the state board requires us to do a licensing due to a young man passing away in a facility, not one of ours, nothing to do with us, but because of that incident, all state funded programs like ours has been extra restricted on what we can and cannot do with the residents and in our facilities. So that's what we faced. Visitations of residents, very restrictive. The kids, their families can visit, but they cannot touch them. They can see them through a glass, just like it will be in a penitentiary area. Even with that, a resident did get COVID from one of the family members who found a way to interact with a kid when security wasn't looking, and we had to quarantine that young man during that time. We've had a few cases here, nothing major. Few of our residents did get COVID through the states sending them out for family visitation off-site, and they came back even after but when they came back, they were put on quarantine in a separate unit. But we're usually housing about 160 residents when we're at capacity. We're currently at 100. And that's really low for us. Our employees are usually about 250 for our company in both facilities. We're probably around 75. So an average employee here at the youth workers, they work 80 hours a week, 40 regular and 40 overtime. So it's pretty taxing currently, but we're doing our best to get through it, hiring 1 or 2 persons here at a time who are not staying at home collecting unemployment. But that's where we're at. But we provide the best food possible. As you see in the background, sometimes we smoke, we grill, and give the residents something different every time. I think I'm doing something different this week with them. With dinner, I'm going to give them one of the meals this week. They're actually going to get White Castle burgers. that I was able to get in from GFS. So just mixing up a bit and give them something, a variety. Even though we were working in 3 weeks, I'll mix it up and throw some specials in there with them. All right, thank you all for listening. I can't stay on very long because I have to head on to work on finish up dinner, but look forward to hear back from you guys later on in the next meeting.
What are you making for dinner? What's for dinner, Xavier? Oh, I think we lost him. We'll move on. Thanks for joining, Xavier. Okay, Carolyn Thomas from Macomb Intermediate School District is also a MFIN Advisory Committee member. I'll turn it over to Carolyn.
Thanks, Colleen. Hi, everyone. I will be as brief as I can and still let you know what's happening in our school districts. So as you know, when we had to close in March, many people only spent the weekend and turned around their food model, did a complete change of feeding kids in the classroom to feeding everyone virtually. And that continued really through the summer. We have some of the districts here in Macomb and St. Clair that have been doing parent bulk distribution pickup throughout the summer and in the school year. We also had some others, and in my own personal case with the district that I am the chief administrator for here at the MISD, we've been feeding children at their home 3 days a week. So we have about 350 staff members involved in this logistical monolith, as I like to call it. It's like the Goliath, but it's a whole lot better than it was. We have 110 buses that are out on the roads, delivering straight to our students. And that went very, very well. But it was a way for our immunocompromised students to not have to get out, for their parents not to have to worry about how they were going to put these kids in the car and get exposed, possible exposure. Well, then when school started, you may know we have a ton of different models going on in the districts right now. There isn't one district that is just doing business as we used to know it a year ago at this time. We have at least 2 or 3 different food service models going simultaneously in everyone's district. We have, in my own case, we're feeding the students in person who want to be here. And within that realm, I have 18 programs. So we have 5 that have decided to do cohorts. So we have a food model within that. So we're feeding them in school. In the rest of our programs, and the other 13, we're feeding them 5 days a week here. But in these other 5, we have students that are only coming every other day. So they have to go home with food so that we can provide them with the meals when they're not here. And so we're doing that. We also are sending food home on buses for our virtual remote learners who cannot get to our schools. We are also doing parent bulk distribution pickup on Wednesdays for a week's worth of breakfast and a week's worth of lunch. And we're not only open to our ISD families, we're open to the community. And that's pretty typical of all of our locals. Everybody's open to the community. We have switched to, thankfully, with the USDA's flexibility, we're running the extended summer food service program now through June 30th, and all of our students are eating free for this school year, which makes a tremendous difference in what we can offer. Our produce needs have, fresh fruits and vegetables have more than doubled with our virtual models, with our cohort models, and even in school with the safety precautions we have to take. We can't really have fresh fruit and vegetable bars yet. So we're doing a lot of individually wrapped. And the good news is, because of the micro purchasing threshold that we're under in our public schools, we can purchase up to $10,000 in a micro purchase to our local farmer. So I know we've done that here 4 or 5 times already this school year, not to the 10,000, But for example, for our apple crunch, we went to one specific orchard and purchased all of our apples like we always have in the past. We've worked with some larger farmers in Macomb and St. Clair. And when they're harvesting, when they have extra, they generally will call somebody, and then I can kind of help make that connection. So we've had corn on the cob in some of our programs in school. We've been doing some Romanesque and some purple broccoli, which is kind of cool because then we can teach the kids that are actually in school. And we've been giving an awful lot of tomatoes to the kids that are virtual because they're so good this time of year. So we've really been working hard at that. Big challenges though are the complete lack of staff most people have in the schools. We don't have any district at 100% staff right now, but we're working towards it. And the other thing that we're faced with is when you have to isolate because you've been exposed. So that takes the staff away too. So we're kind of working through that right now. You're muted, Colleen.
Thank you, Carolyn. Something told me that that tomato photo was just right for you. So
perfect.
Glad to see that. And now we'll hear from Keith Soster from the University of Michigan, Michigan Dining, who is also a MFIN Advisory Committee member.
Hey everyone, I just want to point out that my background, the vertical garden, that's lettuce. So if anybody thought differently, I just wanted to clear that up. And those that know me know that I can talk. And so I actually prepared my notes and I'm just going to read those to you. Our Michigan Dining normally spends, or last year spent with the campus farm, $122,000. Which equates to about 34,000 pounds of fresh produce. And so I want to just give kudos to the campus farm students. They've been a tremendous support, not only to dining in the local food, but they've donated more than 1,800 pounds of fresh produce to the Maize and Blue cupboard. And so part of my responsibilities include the student engagement piece, sustainability initiatives, and then I have oversight of the food pantry on our campus. And so the idea of students helping other students initiative, and they certainly know how to build community. So some adjustments or adaptations that have been challenging for us. When students came back to campus, Michigan Dining limited the menu, and they also standardize them across the enterprise. And this was really meant to limit travel by students, to keep them in their neighborhoods, to prevent cross contact. And so not being able to offer salad bars and the variety of menu items was really frustrating, not only to the students, but the chefs and the staff who put a tremendous amount of work in menu development over the summertime. So we are working to transition from to-go meals, all to-go meals, to reduce our waste, which has doubled since COVID. And so, you know, when you have to package every food item and not allow anybody to sit in a dining room, that can be a real challenge. And so working towards introducing more local and sustainable items back into our menu is where we're at right now. And we hope to be able to do that and continue to do that throughout the rest of the academic year. I want to say this, one of the needs that has been identified is ways to educate our community during the COVID times. The attention on local and sustainable food education has really been diminished because of the angst related to other current events, Black Lives Matter, the election, COVID. Composting and our waste reduction has also been a big challenge for us because everything's to go. And the dining room is generally where we build community by engaging students and educating them through table tents or A-frame signs, cooking demos, that sort of thing. And so that's been an interesting time for us. I want to offer this as kind of tip or advice. We know that the college campus is really designed to engage students, not separate them from each other. And so building community is more important now than ever before, because our entire community feels isolated. And that's just not the students, that's all of us. And so if I could offer advice, if you can, increase your attention to those in need and how you might offer support during these times. We have a saying at the Maize and Blue Cupboard, if you don't need the resource, be the resource. And I've heard some great stories this afternoon from my colleagues about what they're doing to engage in the community and help support. I was reading an NPR article yesterday that said 1 in 4 families across the nation are food insecure. And so our work is important. I think we always knew that. I just wanted to remind people that we're an important part of the food system, and I applaud everybody's hard work and efforts. I know that we're the frontline staff, and so the angst and the stress is something we've carried with us since COVID began. And so I just want to say thanks to all of you guys.
Grant is up. Grant Fletcher from Bronson Healthcare. Interested to hear from a hospital how things are going.
Thanks, Colleen. I want to highlight 3 things that we've experienced that seem to be going very well for us. And I want to preface everything I say with most of my comments would not be possible without our partners at the Kalamazoo Valley Community College Valley Hub, who help us stay in fresh local produce almost all year round. So they've been a critical partner in all of this work. Prior to the pandemic setting in, we were in the process already of ramping up a small commissary operation on campus. That was accelerated dramatically when we had to shut down all of our self-service options, and has resulted in us recognizing that we don't need to and probably won't bring back things like salad bars at our primary hospital campus. But we've found new and innovative ways to meet the demands of our customers, our retail customers who want healthy foods to go through the use of this commissary model. We had already established a small grocery store on campus, and after the pandemic set in, we saw probably more than a 50% reduction in the staff on the hospital campus who are our primary consumers. They make up 85% of the retail business that we do. So with more than half of the staff gone, we saw about a 25% uptick in the business of that grocery store. It turned into an incredibly value-added, highly utilized service for our hospital employees. And we've had a CSA on campus for probably 10 years now, which had waned, over the last few years. Its participation had trickled off, and again, after the onset of the pandemic, the participation in the CSA, I think, more than doubled. I walk by on delivery day now and I see more boxes than I've seen in 5 years. So the CSA participation has really been impressive over the last couple months. We tried a couple things. One thing that didn't work, we tried to reduce and streamline our inpatient dining menus, and it just sucked. It wasn't good. People didn't enjoy it. The quality wasn't there, and it really didn't gain us anything. We didn't really see any major efficiencies from it. But I think, to be fair, we did not see the influx of COVID patients on the west side of the state that our colleagues on the east side saw. As many people have stated, we still have an ongoing need for labor. And then 2 takeaways that we've realized because of the pandemic and the financial constraints that it's placed on us. We had to do a deep analysis of the things we were buying. And as happens every few years, our local purchasing program comes under the microscope. And so we did a deep analysis and comparatively priced all local products, or local meats, produce, all these things, with similar products from broadline distributors, and found that a like for like, and oftentimes we couldn't even find something of comparable quality. Across a year, we're probably realizing about $130,000 to $150,000 savings for comparable products from broadline distributors, which was really exciting and really it allowed me to reinforce the importance of this work with the executive team at this organization. And we also, because of the manufacturing supply chain disruptions in the global marketplace, we took a really hard look at some of the things that we were offering that I generally refer to as food-like substances, and identified a lot of them that we're just going to eliminate from our our menu and from our offerings. So we found some great opportunities to gain some efficiencies, reduce our inventory, and double down on our focus on high quality, locally sourced, real food. That's it.
Did we lose Colleen?
Yeah, I think she's muted.
Yeah, I'm trying to not make too much noise while the speakers are going, but then I forget to unmute myself. Hi, Janine.
Hi.
Janine of Creative Dining Services and also of the MFIN Advisory Committee. Janine, take it away.
Thanks, Colleen. First, I'd like to give a shout out to all of my network peers that are really doing such important work in food insecurity. I'm going to sleep better tonight knowing you guys are on it. And I hope to free up some more bandwidth for myself so I can champion this more strongly than what we are currently doing as well. But this is so important and such a horrible, literally another symptom of COVID, right? I mean, we're all seeing it and experiencing it. So thank you. I'm so grateful for your work. The great thing about going last is that a lot of people have already told your story. I could almost do a copy paste of what Keith shared from U of M earlier. It's very, very much my scenario as well. But briefly, in mid-April, my personal role changed from being all things sustainability champion to can I head up our company's COVID response? And so that's been my life since about the second week of April. And so many things, all things sustainability, I had to literally put on a shelf for a while and really concentrate on operational logistics to really ensure, safe delivery of our services and products, not only for the tens of thousands of diners that we feed every day, but our own staff, which is precious. Not just that everyone is precious, but we went into this short-staffed. I mean, our industry as a whole is short-staffed. And so, I'm seeing nods out there, and many of you have mentioned the staffing situation. Of course, it's only gotten worse, and I fear could get worse this winter, and more on that in a minute. But it really wasn't. I'm very, very proud of a playbook that we wrote and published. It's a 56-page manual, interactive, with about another 56 embedded. Both proprietary and CDC, examples, templates, all kinds of resources, a supply chain, its own supply chain intranet for our company. It is our Bible. It is our operational Bible and continues to be. We have weekly updates on anything that has changed or best practices, or pivot is the name of the game. I've heard that word a lot today too, and we're saying it constantly, pivot. And so far, so good. We at Creative Dining Services, we're located in 14 states at about 95 locations. That would be 14 different state executive orders. And we had about 2,000 employees. And that employee base has been impacted greatly. We are still operating at only about 60%. So many of our corporate dining locations have not reopened and probably realistically won't until the spring or early summer of next year. So the impact of revenue, the impact to permanently and temporarily furloughed employees, all of that is just, it's been awful. It's been awful. However, we're managing. We developed a lot of employee resources for both current and impacted employees very quickly. I'm very, very proud of my company, of how we have managed the people services and the human element of this. But it's still sad. It's sad, and but we're in this for the long haul. Sustainability started popping up for me again at the end of September, when I really needed to especially communicate to our students, why do we have to use so much packaging? Keith talked about this earlier, realizing that we need to do a better job of getting ahead with messaging on why we're doing what we're doing, and that these are temporary these are temporary measures, right? It won't always be this way. We will reduce waste stream again, you know, eventually when we're out of our intense COVID response. We also we're really trying to manage 14 different states' executive orders. I finally got smart and aligned everything with the CDC as the virus became more political. Aligning everything to the CDC made life a lot simpler and less controversial. And so nowhere was that more true in the state of Michigan. And I don't think that surprises many people that it became as political as it has been. Our next big concern is, in fact, we have all hands virtual training next week is doubling down on PPE and distancing as we're getting into whether it's just an uptick of the first wave or we're truly getting into a second wave and with cold and flu season on top of that. And then the holidays approaching where we know we will have employees and diners that ignore some of the advice and probably get together with too many people. We're concerned about staffing levels in January. We're concerned about, as we all go back indoors again, what this means for us. And so we're looking at just really bringing that to the forefront again, prevention. And our focus is just serving up nutritious, delicious, but especially safe food. And eventually really looking forward to what's next when we climb out of this. I think we're going to be changed forever, but there will be some wonderful things that we can bring back right away that will make both us and our diners a lot happier.
Thank you, Janine. And thank all of our speakers. Thank you all for taking the time to share a bit with us. It's hopeful in some respects, but really sobering in other respects. And I think it did provide what we had intended, which was a really good up close and personal look at how things are going out in the field. So I really appreciate hearing those updates.